A little caveat, I threw this slideshow together this morning when we found out Ingrid would not be able to join us, but I think all of this is applicable to what we're going to discuss today and especially in the afternoon. So the idea of building a wellness team or building an interdisciplinary team is that at no point can one person make all of your decisions or make all of the treatment recommendations for managing your Parkinsonism or other condition. So it's pretty well established in literature for healthcare professionals that the best care is achieved through what we call interdisciplinary clinics. Now, Ingrid had experience at the University of Delaware in actually helping found a program, an interdisciplinary program for Parkinson's disease, similar to what I myself operate in at Sheltering Arms and have some previous experience with up in Philadelphia at the University of Pennsylvania. So the idea with these clinics is that not only are you seeing a movement disorders neurologist, but you're seeing a team member from each individual discipline all at once or if needed in multiple sessions depending on the patient's tolerance and scheduling availability. Some example team members include, maybe how we would describe it is at the top of the totem pole, the physician. So ideally you're being seen by not just your primary care, but a neurologist who specializes in Parkinsonism or movement disorder. Other team members may include a nurse or a nurse practitioner, your rehab specialist, so that would be physical, occupational, and speech-language therapy or pathology, a social worker, dietitian, in some cases a genetic counselor. So some of these slides are more applicable when I'm speaking to patients and care partners for Huntington's disease. But then psychology is listed there at the bottom. So in some clinics you'll have the opportunity to speak with a medical psychologist regarding some of the cognitive or behavioral problems or conditions that might arise. Now you'll see in this slide at the center the patient is listed as the largest circle because they're the most important on this team. So this is a patient-centered model of care. The next concentric ring shows family. So it's a team approach. Your family is involved in your care making or decision making and your overall care. But all the other professionals are listed in this outer ring. So some of them we mentioned on the previous slide, and there are a couple other pieces on there as well, such as in the bottom left corner, the palliative care. So the idea of establishing guidelines and recommendations similar to what Brittany just mentioned as far as feeding tube placement, preparing for the future and preparing for possible difficult decisions. You don't want to be scrambling at the last minute if a change occurs. You want to have all these things in place, in case of a complication down the road. So the idea with this model, again, this is adapted from a interdisciplinary care article, would be that the patient is making the decisions when medically able. If not, a family member or care partner is stepping in to advocate for that patient, and they're communicating with all these different professionals. Now the reason we need a wellness team and not just one point person, you can't compete with, you can't succeed with just one person calling all your shots or providing all your care. So if I'm speaking for myself, I see myself as a specialty provider for people with Parkinsonism and movement disorder. I feel very comfortable speaking on exercise and movement quality, and I might recognize things that Brittany or Dr. Cloud are more familiar with, but it wouldn't be my place to be making those decisions. So a specialist is the first to acknowledge what they don't know. So a specialist is going to recommend that you see other team members who are equally specialized within their own discipline to help make these decisions. So you would likely be seen by your neurologist who is going to recommend or refer you to these other disciplines. And if that referral is not made as the patient or the care partner, you advocate for it on your own behalf. You say, I would like to see a speech-language pathologist. I have some concerns with my swallow or my speech. Or I would like to see a medical psychologist because I feel like there are some issues that I need to talk through at this time. So never feel as though you're stepping on our toes as healthcare professionals if you advocate for yourself and want to see more members on your wellness team. So some people, their wellness circle may have 4 or 5 professionals. Some may have 6, 7, 8, depending on the complexity or that patient's needs. There are some challenges to this care. I think the most obvious is getting all of your healthcare team in one room. A lot of us will treat across different networks, different healthcare systems, and it's very hard to relay information back and forth sometimes. And you're dealing with enough of a complication living with the disease. You shouldn't have to be the messenger between all the professionals as well. We can just advocate that you yourself make sure that you're recommending or referring or requesting referrals, I'm sorry, between the different professionals and communicating back and forth, or facilitating that communication back and forth. You go to your physical therapist and you say, hey, I just followed up with my neurologist or my nurse practitioner and they suggested X, Y, or Z, or they changed these medications. It's important that we're all on the same page. In cases where the entire team is housed under one roof, or you're being seen by a true interdisciplinary or multidisciplinary clinic, there are still some challenges, like getting there, so transportation, the frequency of follow-ups. We all recommend this episodic management, to see your specialist every 4 to 6 months or 2 to 3 months in some cases. Scheduling that is really difficult, not just for you as the patient and the care partner, but for the professional, because there are so many patients under their care. So the earlier you can schedule these things, the better. And then at the bottom, the limited availability of clinics might be the biggest barrier. Fortunately in Richmond, we have a number of specialty providers and specialty clinics, but there are some more rural areas that have no movement disorder neurologists, and you might be traveling 2, 3, or 4 hours to seek specialty care. If you have those options, I highly encourage you follow through with that process. So in no circumstance would it do you a disservice to be seen by a specialist. A simple example would be if you tweaked your knee. You could go to a general therapist who treats the whole body and is familiar with general joint injuries and wellness and that sort. But in my personal opinion, if I hurt my knee, I want to go to the knee guy. So that's what I'm saying here as far as a movement specialist or a team of movement specialists. One thing on our end as professionals, a challenge might be poor definition of roles within the clinic, or staff turnover, or new people coming onto the team. So we want to assimilate as best we can. Sometimes it's a little bit beyond our control with who's joining or who's dropping out, or some life changes that happen. Just know that we're always looking out for your best care, no matter who is on your team. Now this slide here actually walks us through the process from diagnosis to potential end-of-life care or bereavement support in regard to movement disorder or neuroprogressive condition. Now, if I could, I would take a giant star and put it next to diagnosis. That's when I want you to start thinking about forming your wellness team. As soon as you know what you're up against, that's when you start building your team. And that team is going to change throughout the course of the disease. But you can see initially it might start with just being diagnosed and having support to actual treatment, complex symptom management, and some of the more complicated decisions in regard to end of life or major medical decision, such as PEG tube placement. So by having a team of wellness specialty providers, you are more likely to address these issues as they arise and address them with the most appropriate and evidence-based medical care. So thanks for winging it with me there.